My name's Melissa Carver, and I'm going to be talking about a national patient safety goal today. I chose to talk about identifying patient safety risks, in particular, identifying patients that are most likely to commit suicide. This is important in our emergency rooms because this is often where these patients present and receive their initial assessments. Early intervention is important as we can treat patients for any behavioral health issues possibly before their situation escalates into a suicidal ideation. In conducting research about suicide, I came across some pretty alarming statistics. More than 800,000 people die from suicide each year. Suicide is the 10th leading cause of death in adults, and even more alarming, it's the second leading cause of death for the age group of 15 years old to 34. This is a trend that has been on the rise from the years 2003 until 2013. As nurses, we're often resistant to change, but this is one particular instance where change can be beneficial. Identifying and treating behavioral health issues early helps provide the best outcomes for our patients. We can reverse this trend, and every time that we prevent a suicide, a life is saved. One real-life scenario that recently occurred in our emergency department occurred after a suicidal patient presented to the emergency room and was assessed by the ER doctor. A 1013 was signed, and the patient was brought to a behavioral health room where safety precautions were implemented and the patient was monitored on camera. A short while later, the patient covered her entire body, including her head, with a blanket, which is often not unusual as the emergency room can be loud and very distracting. However, this patient managed to tear off a strip from her blanket and planned to use that as a suffocation device. Luckily, the incident was rectified and the patient's attempt was unsuccessful. However, the outcome could have been very different. This particular scenario reinforces the importance of reassessing your patients and recognizing the signs of suicidal ideations escalating. One study encouraged developing patient-centered approaches to their treatment plan, including their preferences, their needs, their abilities, and their strengths. It's important that we develop therapeutic rapport with our patients so that they feel trusting us enough to be open and honest with their communication. It's also important to avoid no-harm contracts. Rather, we need to discuss with patients what are their triggers for suicidal ideation. We need to assess their coping skills and identify their support systems. This way, we focus on the positives for this patient rather than the negatives. A behavioral health facility in Tennessee implemented a zero suicide model project where their staff were trained specifically for recognizing and reacting to suicidal behaviors in patients. And within 2 years of implementing their training program, their discharge patients' suicide rates decreased by 65%. That's a huge opportunity for saving lives. Another study the Joint Commission did showed that over 5% of their accredited hospitals were non-compliant in 2014 with conducting suicide risk assessments on patients. They also reported that most patients that eventually commit suicide have received healthcare services within the year prior to the suicide. That's a huge opportunity that is potentially missed by not screening these patients when they are seen and providing an intervention and a treatment plan to them before their situation escalates to suicide. The recommendation by the Joint Commission is that questionnaires can be given to patients as they sign in or while they're in the waiting room that ask about depression symptoms or any suicidal thoughts they may be having. So what can we do? We need to ensure that every patient is completing a risk assessment for suicide with them. We need to ensure that our staff are trained to recognize and respond to these signs of suicide. And we need to be sure that we develop positive care plans for our patients that are focused on their values and their needs and their individual coping skills and support systems. So thank you for listening, and I appreciate any feedback or comments you may have.